Hi, thank you for visiting my website. I'm Dr. Stephen Rosser. In addition to being a chiropractic physician, I'm also a fellow of the International Academy of Clinical Acupuncture, and I'm also a certified chiropractic sports physician. I've been in practice since 1986, but I've been at my present location here in Schaumburg since 1994. In that time, I've had the opportunity to treat thousands of patients with conditions ranging from headaches all the way down to foot problems. Now, when most people think about chiropractic care, they think of back problems, and that's certainly the majority of the patients that we see. So patients that have low back problems, low back pain, sciatica, mid-back problems, neck issues, that's the kind of patients that pretty much make up the core of our practice. But we also treat patients that have shoulder issues, elbow problems, like tennis elbow, wrist, ankle, knee, hip issues as well. A lot of times hip issues are related to the low back, so we treat hip joint problems as well. Basically, if you have a joint and you've got muscles around that joint, we can generally help the patients that come in with those kind of conditions. You know, when a patient comes in, they have basically 4 or 5 questions that they want answered. They want to know what's wrong with them. They want to know if it's fixable. They want to know if I can fix it. They want to know how long it's going to take to fix, and they want to know how much it's going to cost. So let's address those questions real quick. When a patient comes into our office, we take a very detailed history. That history is very important because we want to know how long that problem's been around. If it's been around since this morning, or if it's been around since 30 years, obviously we're going to kind of gear our treatment based on what that history tells us. In addition to the history, we also do an examination. Now, we do a very thorough examination, and we're doing some neurological examination, we're doing some orthopedic tests. We really want to isolate what area of the body is really involved with this injury or this pain that you might be experiencing. So between the history and the examination, we can really gear toward that kind of treatment methodology that we want to work with to really help you get better faster. In addition to the history and examination, we also can take x-rays at my office. And those x-rays, again, gearing toward what's that underlying problem. Is there something else going on in there that we should really know about? Now, in addition to the history, examination, and the x-rays, so for some patients, we really want to know even a little bit more. So we have a very good relationship with an area MRI facility, and we send patients over there once in a while. And from there, we can really get some good ideas as far as what's happening with the patient with sometimes an MRI study. All of this geared toward what is going on with that patient. And if we can really know what's going on with that patient and make a definitive diagnosis, we have a much better idea then as far as the treatment's concerned. So the other question that patients have is it treatable, and can I treat it for them? Well, I can say that 95% of the patients that walk in our office, we can help. And we have been at that pace, I think, for quite a few years. That 5% that we can't help, they have either metabolic problems or some, even surgical need or something like that, and we refer those folks out. But for the 95% that walk in our office, we have the ability between chiropractic, between acupuncture, we have a massage therapist on staff, we do ultrasound, electrical stim, interferential current. We train patients to do certain stretches or exercises to help their condition. We have a lot of tools in our arsenal that really help to make sure that that treatment is effective for the patient and that they're getting better as fast as possible. Now, the other questions that people have are how long is it going to take and how much is it going to cost? And quite honestly, my answer to that is, well, it depends. If a person is 20 years old and they've never had any low back problems, and this morning they just picked up the newspaper wrong or something, obviously treatment protocols and things for a patient like that are going to be much shorter than a patient that has had a problem for 30 years and has never really done anything about it. So when it comes to treatment protocols and length of time, it really depends, and the cost obviously depends along with that as well. I will say though that I'm a Blue Cross Blue Shield PPO provider. We do bill other health insurances as well. If you've been involved in an auto accident, we deal with auto accident companies all the time. If you've been involved in a work-related injury, we deal with workers' comp insurance as well. The bottom line is we want to get you back to whatever you want to do as fast as possible. That means we get you out of pain and we get you back to doing what you want to do. Let's be honest for a second. The bottom line is I've been doing this for a long time. And since I said since 1986. In 2001, I had a couple of herniated discs myself, and and I was on the floor for a week. And I know what it's like to be in very severe pain and not be able to move. From that point, I had chiropractic care. I didn't have to, go through a surgical kind of procedure. Now I keep myself into some, personal fitness kind of thing, and keep that low back as strong as I can, and do the things that I need to do to keep myself from having a relapse of that kind of problem. So I know if you're having that low back problem right now, I kind of know where you're at. I've been there. I've been in personal fitness for a long time myself. I just a couple years ago got a black belt in the martial art of Hapkido. So I know where I've been, and I know what I can do, and I know I can help you do the same thing. In the chiropractic industry right now, there's a lot of guys that are kind of doing this franchise thing. I'm not a franchise guy. I'm a sole practitioner, and my goal is to provide patients with the best care possible. I don't have you sign some long-term contract kind of thing and demand a bunch of money from you up front and expect you to come in here for the rest of your life. What I'm about is providing a good service for patients. The patients that come in here, I think, are coming in here because of the valuable service that they see in what they receive here, and they're not coming here because of some kind of contractual obligation. So that is really what I'm focused on, is providing a good service for patients and helping them and empowering them. And that's what really is my passion, is empowering patients to get to the point where they can have the understanding that their health care, to some extent, is under their control. And yeah, I can kind of help them get to that point and show them some things to do. But I really I get fired up when I see people taking responsibility and doing the exercises, doing the stretching, doing the things that they need to do, very simple things, and don't have to go crazy with some equipment or whatever, but very simple things you can do to really take some control of where you're at. If that resonates with you, if you appreciate that kind of approach to some kind of health care, then I'd really welcome you to the practice. I would request that you give us a call, come on in, ask me some questions, or just call me on the phone. My secretary, my office manager, Sandy, she'll be more than happy to take your call, or I'll take your call myself, or leave a message in the machine. I will get back to you. I'd love to see you and treat you and have you part of our practice family here. Thanks for watching the video.